Hi, I'm Dr. Parrul Aggarwal, clinical lead and senior IVF specialist. I would like to answer a very important question. That is, what is the difference between a laparoscopy and a hysteroscopy? Laparoscopy is a technique in which we put a telescope and a camera inside the belly button and we go inside the tummy to look inside it. We look about the normal organs and if there is any pathology. If there is no pathology and we come out, we call it as a diagnostic laparoscopy. But if there's any pathology and we have to operate on it, then we call it as an operative laparoscopy. In case of any infertility, what we do is sometimes we put the dye from below and we see the flow of the dye from the tubes into the tummy to see whether the tubes are patent or not. Also, any pathology like if there is any excessive stickiness, we call it as adhesions, can be removed there and at that moment of time. The second technique is hysteroscopy, in which we put the camera inside the uterus to look inside the uterus. If we just look and come out, we call it as a diagnostic hysteroscopy. And if we find any pathology inside the uterus and make up our mind to operate on it, we call it as operative hysteroscopy. The pathologies can be any, like polyp, fibroid, could be a septum, or could be any stickiness or adhesions inside which we have to remove. These are some of the causes which can cause infertility, and these techniques are used to help a doctor, a fertility specialist or a gynecologist to overcome the infertility issues. So I recommend everyone, if the doctor recommends you to undergo a laparoscopy or a hysteroscopy, you should know the indication for it, and thereafter you can undergo this particular procedure. Thank you.